Tinnitus is a common problem affecting about 44 million people in the United States. It greatly disrupts these people's lives. Flatirons Audiology specializes in treating tinnitus. The staff is committed to making sure tinnitus will no longer impact your life. Dr. Julie Eschenbrenner, owner of Flatirons Audiology, has been licensed to practice audiology for more than 15 years. She's a board-certified audiologist. She's in good standing with the Colorado Academy of Audiology and specially trained in neuromonics and tinnitus retraining therapy. Dr. Julie Eschenbrenner joins us today. Thank you for being here. Now, why don't you tell our viewers what is tinnitus, and also what is the proper way to pronounce it? Because I hear tinnitus and I also hear tinnitus.
It doesn't matter how you pronounce it. It's different. People say different things. It really doesn't matter. But what it is the presence of a sound in the absence of an external sound. So some noise that you hear inside your head that is ringing, buzzing, hissing.
That only that person can hear.
Only that person can hear, correct.
All right, how do you evaluate then tinnitus?
Well, it's a really subjective evaluation because you can't see it like a broken arm, but with their ways of matching it, pitch matching it, loudness matching it, see how much it takes to cover it up, and evaluating. Most people have hearing loss as well, but some people don't. A regular hearing test, you only evaluate the speech frequencies. With tinnitus, we evaluate the higher frequencies because most people have high frequency tinnitus.
All right, now I've heard that there's nothing you can do to cure it. Is that in fact the case, or can you cure tinnitus?
You can't cure it because it's not a disease process itself. It's the side effect of something else. What it's the side effect of could be hundreds of thousands of different things, but there are ways to treat it to make it less annoying, make you less aware of it, less disturbed by it, and eventually decrease the perception of it and improve your quality of life.
When should someone seek treatment? Should it be as soon as they start hearing things that only they can hear, or can they wait, or when's the best time to treat it?
The best time to do it would be if you're really bothered by it. If you're having trouble and you look out a screen door and all you see is the screen, if the tinnitus is interfering with your abilities to concentrate and to communicate with your family, and you're generally crabby and it's just impairing your ability to sleep, then do something about it.
Yeah, and that's a great point. So, I mean, if they can live with it, great, but if you can't, you need to seek treatment. All right, well, that makes a lot of sense. Well, we have a testimonial, actually, from one of your patients. Let's listen to what Lisa has to say.
Great.
The words I used when I walked in the door here, I want to rip people's heads off. Because it hurt, or it was not painful, very much discomfort when people talk to me, because my ear is so loud. Tinnitus was just so loud. I had Dr. Julie's card for a couple of months before I called. And finally my husband said, just call her. I know you've been through a lot, just call her and see if there's anything she can do. First time she put the machine on, I started to cry because it was so much more comfortable. If you're noticing it, call Dr. Julie and let her see if the neuromonics device will help you. Don't wait, make the phone call and go now. So much easier.
So she mentioned the neuromonics device.
Mm-hmm.
Is that the most effective way to treat tinnitus?
If you're significantly bothered by your tinnitus, that's the best thing. It's the only device that's FDA approved and clinically validated to treat tinnitus, but it's not the only thing that's available. It's the only one FDA approved and cleared because it's the only physical, all-encompassing thing. Mm-hmm. Everything else is a combination of things.
All right. So you can treat people on different levels, and
Absolutely.
Maybe that's for the most severe?
Absolutely. The neuromonics is for the most severe people, but sound therapy in general is the way to treat tinnitus. Neuromonics is for the most severe people, but then there's also hearing aids. Most people have tinnitus and hearing loss and loudness tolerance issues, so there's amplifications new to the market that address both. Some people need just enriched listening environments, but just getting some kind of sound therapy isn't the end-all be-all. You need some counseling to help retrain the brain at a subconscious level that the tinnitus is not an important stimuli and to get past it.
Great. Well, you actually quickly tell us about a seminar that you have coming up on March 3rd.
Well, Thursday night at 6 p.m. at Exempla Good Samaritan Medical Center, we have a free seminar. And what is going to be there, we're going to talk about tinnitus, all the history and all about it, and then also treatment options, and representatives from the different manufacturers are going to be there, from some of the hearing aid manufacturers, from neuromonics are going to be there as well to answer some questions.
Can people test at that seminar?
People can't really test at the seminar, but we can make appointments at that seminar.
Okay, to have them come in and test then.
Absolutely.
Excellent. Well, Julie, thank you so much for this great information. I'm going to tell our viewers how they can get a hold of you.
Thank you.
Flatirons Audiology is committed to maximizing your hearing potential by offering comprehensive tinnitus treatment plans. They accept most insurance, including Medicare, for the evaluation of hearing and tinnitus. On Thursday, March 3rd, they're conducting a free tinnitus seminar. Call for more information. Their number is 303-664-9111 or visit their website, flatironsaudiology.com. The first 10 callers to mention Haystack right now receive $200 off the cost of treatment. Their number again is 303-664-9111.